Imagine waking up one morning feeling less pain in your knees than you've felt in years, all thanks to a remedy straight out of Grandma's kitchen. It sounds like a dream, but recent studies are giving new respect to the natural treatments our grandparents swore by. In fact, researchers found that the active spice in Grandma's turmeric paste can ease arthritis pain as well as over-the-counter drugs. Even castor oil packs and warm Epsom salt soaks, yes, Grandma's old tricks, show real benefits according to clinical trials. Today, we're revealing Grandma's secret arthritis cure, a simple, time-tested blend of herbs and home remedies, and looking at why doctors are finally nodding in agreement. Arthritis is a challenge many seniors face every day. In simple terms, arthritis means your joints are swollen and inflamed, causing stiff, aching knees, hips, hands, or shoulders. This is very common. About 58 million Americans have doctor-diagnosed arthritis. For older adults, that translates into 1 in 4 people struggling with sore joints. We know what it feels like. Mornings where stepping out of bed hurts, or grinding pain when you try to climb stairs or open a jar. Everyday tasks like gardening or even hugging a grandchild can become hard or downright painful. It's frustrating and lonely to deal with chronic pain that limits what you can do. Many seniors feel trapped between having to choose more pills, dealing with side effects, or living with constant aches. In short, arthritis is common and it hurts, and that's why so many people are eager for safe, gentle relief. Even remedies Grandma might have known about. Many seniors have already tried the usual solutions and found them wanting. Consider the standard treatments and their drawbacks: pain pills, NSAIDs, and acetaminophen. Doctors often prescribe anti-inflammatory pills like ibuprofen or naproxen for arthritis pain. These can help, but long-term use can be dangerous. As the Mayo Clinic notes, even over-the-counter NSAIDs can irritate your stomach and sometimes cause ulcers or bleeding. High doses or long use risk kidney problems, fluid retention, and high blood pressure. Older adults are especially vulnerable. Acetaminophen and Tylenol is easier on the stomach, but it often isn't strong enough for arthritis pain. In short, pills may quiet pain temporarily, but they can also create new problems. Steroid injections. Some doctors inject cortisone into aching joints for quick relief. These shots can reduce inflammation fast, but new research raises alarms. A 2019 radiology report warns that steroid injections might actually accelerate joint damage rather than protect joints. Dr. Ali Gurmazi explains that we used to think if these shots don't hurt you, but now we suspect that may not be true. In fact, they have been linked to faster cartilage loss and bone problems in the joint. So, while a cortisone shot can feel like magic at first, it may shorten how long your joint lasts. Joint replacement surgery. In severe cases, hip or knee replacement can relieve arthritis permanently, but surgery is a major decision, especially for seniors. Orthopedic surgeons warn that every joint replacement carries risks. Anesthesia stress, heart complications, and blood clots are possible after surgery. For example, one review found that up to 13% of patients developed a clot in the week or two after a hip replacement. Recovery is slow, too. You'll spend weeks or months in rehab. Many seniors worry about these risks, especially if they have heart disease, diabetes, or other health issues. Other treatments. Over-the-counter creams, braces, or supplements might sound harmless, but they often only temporarily soothe or even disappoint. Capsaicin creams, heat wraps, glucosamine pills, and the like can give mild relief for a short time, but none of them cure arthritis. Many people cycle through dozens of remedies and still feel stuck. In summary, conventional treatments for arthritis can relieve symptoms, but they all have drawbacks. Pills can upset your stomach and kidneys, injections may harm your joints, and surgery is a big ordeal. No wonder many seniors are left feeling frustrated and still in pain. You've probably heard friends say, "I've tried everything and nothing worked." If that sounds familiar, keep reading, because Grandma's Remedy might offer the relief you're looking for. Grandma's Secret Remedy. When modern medicine hits a wall, Grandma's wisdom often takes center stage. Think back, what did Grandma keep in her pantry? Maybe a jar of turmeric powder, that bright yellow spice, or a bottle of pure castor oil, or even a box of Epsom salt in the bathroom cabinet. These humble items, used for generations, make up Grandma's remedy for arthritis. Let's explore what Grandma might do and why it helps. Turmeric and honey paste. Grandma knows the power of her golden spice. She might take a spoonful of turmeric powder from India or your local market and mix it into a warm paste with honey or milk. This homemade tonic was said to calm the pain and reduce swelling. Now we know why. Turmeric's active compound, curcumin, is a natural anti-inflammatory. In Grandma's living room, she might sweet-talk you into sipping turmeric tea or rubbing a warm turmeric honey paste on your knees at night. It sounds simple, but science backs it up. One study showed people with arthritis had greater pain relief from 500 millimilligrams of curcumin than from a dose of diclofenac, a prescription pain drug. Another review found curcumin eased knee arthritis pain just as well as ibuprofen. In other words, Grandma's spicy drink and paste really contain the same anti-inflammatory magic as a pharmacy pill, minus the stomach side effects. Castor oil pack. Castor oil might seem like a weird old remedy. It's thick and smells strong, but Grandma swears by it. She would soak a clean cloth in warm castor oil and wrap it around her sore joint, maybe her knee or ankle, then go to bed. The idea is that the oil penetrates deep into the tissue. Castor oil is rich in ricinoleic acid, a fatty acid known to soothe inflammation. Health experts note that ricinoleic acid has pain-relieving and anti-inflammatory properties, which could ease stiff joints. And we have clinical proof. In one study of older adults with knee arthritis, taking castor oil, 0.9 milliliters capsules, 3 times a day for a month, worked just as well as diclofenac, a strong anti-inflammatory drug. Even better, the diclofenac group had many side effects, while those on castor oil had none. So Grandma's nightly castor pack isn't just folk wisdom. It's a therapy that a clinical trial showed can really reduce pain without the nasty drug side effects. Warm Epsom salt soak. Finally, Grandma might fill the bathtub with warm water and stir in a couple of cups of Epsom salt, magnesium sulfate. Then soak her aching joints for 15-20 minutes. It feels gentle and relaxing. Why magnesium? Magnesium supports muscle relaxation and many body processes. When you soak in an Epsom salt bath, you get heat on your joints, plus a dose of magnesium and sulfate in the water. The heat itself helps. Warm water is well known to relax muscles and increase joint mobility. Doctors say even moist heat on painful joints loosens them up. On top of that, spa studies suggest mineral baths, like Epsom soaks, can lower inflammation from the inside. For example, researchers found that after soaking in mineral-rich water, levels of key inflammatory chemicals, interleukin-1 and TNFR, actually dropped while the body's natural painkillers, endorphins, went up. In practice, many seniors report their muscles feel looser and pain softer after a warm Epsom soak. In short, Grandma's bath remedy combines soothing warmth with minerals that may reduce swelling. Real stories. Imagine your neighbor, Mrs. Johnson, a 72-year-old retired teacher. She tried every cream and pill, but her knees still ached. Then her granddaughter recalled Grandma's recipe. Every night, make a paste of turmeric and honey, drink a cup of warm turmeric milk, and soak in the tub with Epsom salt. After a few weeks, Mrs. Johnson noticed her morning stiffness was easier. Or picture Grandpa Ray, who rubs castor oil on his shoulder at bedtime. He says it feels better in the morning. These stories might sound like home remedies, but science is catching up to Grandma. Throughout these remedies, doctors emphasize safety. You can try these home therapies with your usual treatment, advises Dr. Mark Landry, a rheumatologist, quoted in patient magazines. He notes they are generally low risk when used properly. Just don't skip your prescribed medicine without checking with your doctor. Grandma's methods are additions, not replacements. How can kitchen spices and bath salts actually help? Here's the key. Arthritis pain is all about inflammation. Inflammation is caused by certain enzymes and immune messengers that attack the joint tissue. Grandma's remedies happen to contain natural blockers of those inflammatory signals. Let's break it down. Curcumin versus cytokines. Curcumin from turmeric inhibits many molecules in the inflammatory chain. It famously blocks COX-2, the same enzyme targeted by drugs like Celebrex. It also tampers down pro-inflammatory cytokines like IL-1β and TNF. In real patients, this makes a difference. A 2021 review of 15 clinical trials reported that curcumin relieved osteoarthritis pain and stiffness as well, or even better than standard NSAID medications. That means Grandma's golden milk can actually work just as well as chemical drugs, with fewer side effects. In rheumatoid arthritis, an autoimmune form of arthritis, curcumin even helped balance immune cells and significantly reduce disease activity at doses as low as 250 to 500 milligrams twice daily. In short, curcumin does scientifically what Grandma expected. It turns down the inflammation inside joints. Ricinoleic acid, analgesia. The main component of castor oil is ricinoleic acid, a fatty acid with pain-relieving power. Lab studies show ricinoleic acid can decrease inflammation and ease pain in tissues. This is why castor oil packs soothe sore joints. Clinically, the evidence is compelling. The knee arthritis trial we mentioned found castor oil's effect on pain matched that of diclofenac. Because it's a natural oil, there were essentially no adverse reactions. Doctors at the trial concluded castor oil can be an effective therapy for osteoarthritis. In other words, your grandma's sticky bath oil has a real anti-inflammatory ingredient that doctors have studied and approved as safe. Magnesium bath effects. Epsom salt, magnesium sulfate may help in a few ways. First, magnesium itself helps muscles relax and regulates nerve signals. Soaking in warm water raises circulation and warms the joints, which makes pain nerves less active. As P.T. Mora Everson explains, the thermal benefits of a warm bath are well known. Warm water alone relaxes muscles, increases joint mobility, and reduces pain. But there's a bonus. Spa research, balneotherapy, suggests the minerals do get into your body. Studies found that after mineral baths, Patients had lower levels of interleukin-1V and TNF-A, inflammatory markers, and higher endorphins, your body's natural painkillers. Although home Epsom baths haven't been as rigorously tested, experts believe that dissolving a few cups in your tub may give similar soothing results. At minimum, it's like getting a gentle anti-inflammatory soak at home. Clinical evidence. All these effects aren't just theory. Here are some specific research highlights. A 2016 systematic review of trials on turmeric/curcumin found significant reductions in arthritis pain scales. The authors concluded these RCTs provide scientific evidence that supports the efficacy of turmeric extract, about 1,000 milligrams a day of curcumin, in the treatment of arthritis. In other words, higher doses of curcumin have been shown to reliably ease pain. In knee arthritis, specifically, one study showed 500 milligrams curcumin worked better than a dose of diclofenac, an NSAID, at reducing pain. Other research confirmed that turmeric extract can match ibuprofen's effect on knee pain. A double-blind trial gave knee osteoarthritis patients either castor oil or diclofenac pills for a month. Both groups had significant improvement, P01, but the castor oil group had no adverse effects while the diclofenac group did. The study authors stated, castor oil can be used as an effective therapy for knee arthritis. A small rheumatoid arthritis trial compared placebo to 250 milligrams or 500 milligrams curcumin twice daily. Both curcumin doses significantly outperformed placebo on all measures, lowering inflammation markers and improving symptoms. This shows even a modest amount of curcumin taken regularly can help serious arthritis. Spa/balneotherapy studies, though done in spa settings, not grandma's kitchen, found that multiple mineral bath sessions improved joint symptoms in people with osteoarthritis and psoriatic arthritis. Italian researchers saw significant improvements in joint and spine symptoms after mineral water baths, and balneotherapy helped fibromyalgia patients sleep and reduce overall pain. These modern reviews support the idea that warm mineral soaks aid arthritis. In summary, the scientific consensus is that grandma's remedies hit the right targets. Curcumin, turmeric, and ricinoleic acid, castor oil, are natural anti-inflammatories that have been validated in real studies. Warm baths may not cure arthritis by themselves, but they can calm pain and aid healing. Altogether, the labs and clinical trials show grandma's secret weapons have serious merit. That's why doctors say it's fine, and often helpful, to include them alongside your usual care. Grandma's arthritis remedy isn't a magic cure, but it's a powerful, time-tested tool in your toolbox. When you mix her turmeric honey paste, castor oil packs, or Epsom salt soaks into a healthy lifestyle, you can often cut your pain and stiffness further. Think of it this way. Modern science and grandma are on the same team. By combining her simple treatments with doctor-approved care, many seniors finally feel their aches lessen. Make it part of your plan. Don't rely on grandma's trick alone. Use it with proven strategies. Gentle daily exercise can make a huge difference. The Mayo Clinic emphasizes that even moderate activity, like walking, swimming, or stretching, strengthens muscles and eases joint pain. It also helps control weight, which takes pressure off painful knees and hips. Eating well is important too. Follow an anti-inflammatory diet rich in fruits, vegetables, whole grains, and healthy fats, olive oil, nuts, fish. Dr. John Davis from Mayo Clinic points out that small weight loss and nutritious foods can lower overall inflammation in the body. In other words, ditch the excess sugar and processed foods, add more greens and omega-3s, and your joints may thank you. Other tips. Stay hydrated and consider gentle movement every hour, even light stretching. Use heat and cold packs as needed, warm towels or ice packs. And keep taking any doctor-prescribed GI medications unless you speak with your doctor. Grandma's methods work best in addition to regular treatments, not as a complete swap. By embracing Grandma's remedy along with lifestyle tweaks, regular exercise, a healthy weight, and an anti-inflammatory diet, you can often reduce how much medication you need and boost your mobility. Over time, many seniors find they can walk easier, sleep better at night, and enjoy hobbies again. It really is heartening to see such a simple set of cures offering real, science-backed relief. Thanks for watching our deep dive into Grandma's secret arthritis remedy. If you found this helpful, hit subscribe for more natural health tips, and check out our next video on gentle exercises that can further relieve joint pain.